time once again for Community Forum, and we are very lucky to have back with us live in the studios Donna Smith. Donna Smith is best known for her role in Michael Moore's 2007 documentary film Sicko. She has been honored by the Associated Press Managing Editors with 15 regional awards from 2004 to 2006, and recognized by the Inland Press Association with top honors in 2006 for community-based journalism. She worked in Washington, D.C. as an advocate for community, and community organizer for National Nurses United, California Nurses Association, National Nurses Organizing Committee. And she is currently the executive director of Healthcare for All Colorado and executive director of Progressive Democrats of America. Donna, thank you very much for coming in and spending time with us this morning.
Of course, Mike. Thank you for having me.
So start out, tell us about your organization. Start out with two organizations. Start out with Healthcare for All Colorado.
That will be fun to do. Healthcare for All Colorado was formed about 10 to 12 years ago with a small group of people, but a committed group of people who thought that having a Medicare for all single-payer type healthcare system would be the best way to go for people in Colorado and nationally. And at least initially, the group worked primarily to support national efforts to pass John Conyers' bill, H.R. 676. And then over the years, that started to change as people found the situation in the healthcare system more and more desperate. They felt like at least we ought to try on the state level. If we couldn't move anything on the national level, we ought to try on the state level. And in Colorado, there still is, fortunately, direct access to the ballot by citizens. If you can gather enough signatures to get something to the ballot, then you can take it to fellow voters rather than taking it just through the legislature, which is problematic in Colorado the way it's problematic in so many other states around the country. I often remind people that although Colorado, yes, legalized recreational marijuana through a ballot initiative process, that does not mean that we have a very open and very progressive kind of legislature. Quite the contrary. Just a couple of years ago, two very fine legislators were put out of office by the people who support gun rights, and they saw these two as being too proactive in terms of gun control legislation, and they targeted them to remove them from office, and they did. And the chilling effect that had on almost every other issue in Colorado was really hard to deal with. We started out, Healthcare for All Colorado started out by doing a healthcare as a human right ballot effort about 3 years ago. So we gathered signatures, all volunteers. We gathered signatures, and it was a very simple amendment at that point that just stated we want healthcare to be treated as a human right, and we direct the state legislature to make it so. And we gathered about 25,000 signatures with volunteers, but not enough to get to the ballot. We needed about 100,000. We didn't get enough. But we felt like, using just 100 and some volunteers, that wasn't a bad deal. We didn't have $250,000 in the bank to hire private signature gatherers, which many organizations do. So we said, all right, we'll go back to the drawing board and we'll try again later on. In the meantime, there was a subset of Healthcare for All Colorado activists who decided they were going to develop this new plan called Colorado Care. And they started to develop what that would look like more fully. And they first tried to push it through Colorado's legislature, and they had a wonderful sponsor for the legislation in the Senate. Senator Irene Aguilar was chair of the Senate Health Committee. All indicators were, boy, this is something we can really get some traction on. Well, no go. The legislature just cut the knees out from under that moving to any kind of full vote of the Senate or getting it over to the House side. Forget it. It wasn't going to happen. So then the decision was made, all right, maybe we're taking this whole thing to the voters of Colorado, to the ballot. So essentially that legislation that was drafted in for the legislature was recrafted just slightly to read better as a ballot amendment. So the effort started again to gather signatures. A couple of super committed volunteers donated enormous amounts of money. When it became clear that the one person even got a second mortgage on her home to help pay for signature gathering, which is just, it's a commitment that it's hard to fathom that people believe that strongly about it. So when we knew that signatures weren't really going to make it, there was an infusion of cash, paid signature gatherers were put out on the streets. and more than enough signatures were gathered to take it to the ballot. So Colorado Care will be on the ballot in November. It's now known as Amendment 69, and it would provide health care for everyone, every resident of Colorado. It doesn't matter whether those people are documented or undocumented. Every resident of Colorado would be covered for their basic care and for medical services that they need at a cost that would be a fraction of what the Affordable Care Act allows people to do right at the moment. So it's a pretty exciting time in Colorado. We've already seen some energy pushing back against the ballot amendment. And so there's a real need for people to pay attention to this in Colorado and watch. It's the same kind of dynamic we've seen when we try to push single payer anywhere else. The anti-tax, anti-government groups just step up and start to spill their vitriol everywhere. And so we're going to see that in increasing amounts in Colorado. And now that we're watching the political environment be really charged up this year, it's interesting to see whether or not we'll have the capacity to make that pass at the ballot will be somewhat determined by turnout in November, what the presidential race looks like at that point. So it's a kind of a wait and see at this moment and educate fellow Coloradans about why it matters that we get this passed.
Are you anticipating the healthcare industry cartel folks to be weighing in at this point?
Oh, the cartel. Oh, those people. I have no idea what you're talking about, Mike. Yes, of course. In fact, the industry group in Colorado that works with, health insurance industry folks, not so much the Colorado Hospital Association, which we're sure will also weigh in soon. But we're told that the insurance industry group has already said that they will commit up to $40 million to defeating this amendment at the ballot, and more if necessary. So when you listen to that and you think about, wow, that should tell everyone in Colorado and everyone everywhere how much money's at stake in this system, how dear the profits are to the health insurance industry. And where do you think they get that $40 million from? From all of us who pay premiums every month. I tell people all the time, I pay more than $700 a month right now for just me for coverage under the Affordable Care Act through the exchange. So, when you think about that, the insurance industry is not giving that up easy. They're not going to go down easy on those issues. And we saw in Colorado an interesting campaign about 2 years ago where the GMO labeling folks really had a strong, and people in Colorado were fired up about that. They were excited. Yes, I want to know where my food comes from and what's in it. They waited until 3 weeks before the election, the anti-labeling folks. They threw an enormous amount of money into a TV campaign in which they show farmers standing on the plains of eastern Colorado, windblown and looking very American. And, talking about the fact that, if I have to label all these things, then it's going to hurt my family farm, what we've had for generations, it's going to go down. And that measure went down 67% to 33% after there was massive public support. So it's tough. It's a tough political environment. And yes, the forces against this changing will be out en masse to make sure that it goes down, or to try to make sure it goes down. So what we all have to hope in Colorado is that the energy that's now surfacing in the presidential race, this populism that seems to be resurfacing in our society, will be strong enough to carry people through to start talking about these issues more. And to those people who aren't as well educated on healthcare reform, for them to take a look at it and say, yes, it's going to raise my taxes a little bit, but then I don't have to pay those enormous premiums, the copays, the deductibles are gone. My fear about what happens to me when I get sick, gone. And I can finally start having a little bit of income security.
Well, the populism we're seeing right now is, we're seeing both the good and the bad in a way, depending on your definition of things. But we're seeing a right-wing version of populism and what appears to be a left-wing version of populism. Is that being the Bernie Sanders campaign? Is the Sanders campaign helping this cause, at least in visibility?
In visibility, I think in terms of, every time Bernie goes out and talks about the way our healthcare system should be, that we should have a Medicare for all single payer system, it elevates that issue for all of us. And I think that you can't overestimate the importance of that, but you're so right. On the other side of the argument, we have the people like Donald Trump and the people like, although I hate to even say his name sometimes, or Ted Cruz, or pick anyone on the conservative side of the aisle. And one of the things they assure the American public about over and over again is day one, they're going to be the ones that rip away the Affordable Care Act from as if that will be a great thing for people in this country. And it's hard for me to fathom how even conservatives can look at saying those kinds of things, because there are lots of conservative people who are among those who have benefited from some parts of the Affordable Care Act. There are certainly things about it that are not good. Absolutely. I think the affordable word in it is probably a very relative term, at least for me and for millions of other people. But the issue of no pre-existing conditions, being able to get a policy where in the past insurers could just deny people coverage. They can't do that anymore. And then the major advance of the Affordable Care Act has been the expansion of Medicaid, and the fact that so many millions of people who had absolutely no access in the past have access now. So for anyone to argue that we're going to pull that away from the people is insanity. It just truly is insanity. So you're right. If we look at this populism, it's kind of a double-edged thing right at the moment on whether or not we think those saner voices, as far as my position goes, those saner voices in our midst saying we're in this together, folks. This isn't a you get yours, I get mine, and we fight each other for who gets the most or the best or whatever. We are together in this, whether it's the planet, healthcare reform, all of these issues, we're in it together. And we'll see. I'm very hopeful. That the populism that I support, which is what Bernie Sanders certainly puts out there, is the one that will prevail.
So last time you were on the show, I believe it was 2010 or thereabouts, and you were representing the nurses nationally. And I was shocked and saddened to read on your blog that you are no longer with them, and the circumstances that led to being in your current position actually it looks like I was gonna say a mixed bag, but
it's true.
So can you talk about that?
Sure. I mean, it was one of the joys of my life to be on staff for National Nurses United and the California Nurses Association. What a blessing for me, following the trauma that led to our being included in SICO, the having gone bankrupt even though we were insured, and surviving cancer, and my husband surviving all his heart stuff. I loved it. I adored the work I did for them, but I was still having some health concerns. I had a recurrence of a cancer situation, and then I also was having some pretty serious problems with anemia. And I just could not keep up the level of energy that was required in that position, and I knew it. And I also knew if I was going to have deteriorating health issues, I needed to be closer to family. So it broke my heart, and I had to say to them, I need to step away and move back to Colorado where my family is, from Washington, D.C., which every political junkie on the planet, Washington, D.C. is the place to be. I mean, we may hate it, and we may talk about the hot air that blows out of there, and that's all true. But those of us who are into politics, there's no better place to be. So back to Colorado I went. For a period of months, I struggled with my new employer did not have a way to provide health insurance benefits for me. So I was paying those out of pocket myself, and my health continued. There were still issues. There were still problems. And last year on St. Patrick's Day, I was standing in my kitchen just fixing some lunch, and I felt kind of this whoosh. That's the best way to describe it. And I felt like, oh my God, I don't know what's happening, but I'm going to go down. I don't know. And my husband was 20 feet away in the living room. I couldn't speak. There was nothing I could say. I started to pour sweat, and I thought, I don't know if this is what it feels like to die, but if it is, something's going on. So I kind of laid myself across the counter, and I waited until I could compose myself and tell my husband, something's very wrong with me. I need some help. And he got me to the chair, and we sat, and he has a blood pressure cuff because of his heart stuff, and I was super low. I think my blood pressure was 80/50 or something. It was very bad. So we knew something was going on. Now, he wouldn't call an ambulance because we were afraid about the cost and where they would take me. So he put me in the car and drove me. Well, I had a massive hemorrhage, a massive GI hemorrhage. And so that was what was behind the anemia for all those months that I'd been getting transfusions and iron infusions and all sorts of stuff to treat anemia. And so while I was there, an IV site started to not look so good. And they discharged me home after a nurse had kind of said, I don't like the way that IV site looks. And the doc said, it's superficial. It's all going to be okay. So I went home. Well, within 36 hours, that IV site was not good. My arm was really not in good shape. I had 103 temp. Back to the hospital I went. I had contracted MRSA through that IV site. So, and it had become septic very quickly. Because it had been in an IV site in my left arm. And so they started, of course, the blood cultures came back super fast with being positive for MRSA. The doc had already started a very high level, vancomycin was the name of the drug, to try and attack the MRSA, but they also took me to the operating room in the middle of the night, took a vein out from my wrist to my chest wall because of its infection with MRSA, and it darn near killed me. That was a terrible experience. In the midst of all that, though, I tell people, in rolls the business office person with her little computer on the little thing and says, Donna, how would you like to pay your $250 copay today? I was so ill, I was practically delirious, couldn't speak, and my husband made a comment that I probably can't repeat on your radio show, but asked the young lady to leave the room, said we won't be paying that deductible. And so how horrible, though, how horrible that we have a system that does that to people. And my fear the entire time I was in the hospital, my fear was, oh my God, how am I going to pay my bills? How am I going to pay that insurance premium? It wasn't that I was going to die. In fact, there was a small part of me that thought, if that's going to be the end result anyway, let's get on with that and be done with it, and then my family won't be left with some hideous amount of billing. Now, bear in mind, the MRSA part of that hospital I've never seen one bill for that of any kind. So somehow that is gone. I think the Affordable Care Act had some things about readmissions in it. I know it did, about hospital readmissions and what happens in those situations. So thank God we weren't made financially responsible for that. But these are the kinds of things that are still happening to me and to millions of other Americans. Is the first thought is never about, am I going to die? Do I need to see a doctor right now? Do I need an ambulance? Whatever I need, it's always, how am I going to pay for this? How am I going to manage to keep myself alive? And to do this cost-benefit analysis, is my life worth that to my family? So that's kind of a long answer to your question, but that's what happened.
But you had, during that period of time when you had anemia and you were going to the hospital regularly, you had an inkling that there's something more here, and you were trying to give hints to your doctor then, who, at least according to your blog, didn't seem real receptive or had the time to look into your situation the way that perhaps if there was a more robust system, it might have been addressed.
Absolutely. That's so true. And thank you for reading that on there. And one of my frustrations, and I think millions of people have this frustration and don't have access. I hang around with a lot of docs in my work, which is wonderful. But I had these docs on the side telling me, you're bleeding somewhere. You are bleeding somewhere. No one needs to have blood transfusions and iron infusions and all of these things for years unless you're bleeding somewhere. And so I would go back to my doc and say, oh my God, I can't breathe, because turns out having red blood cells is kind of important to transporting oxygen in your body. So by the time it got really severe, that the anemia, I couldn't breathe. I would walk half a block and I'd be gasping for air. My family was so upset with me because they said, why can't the doctor find what's wrong with this? I said, I don't know. I'm trying to get answers on this. And just the weekend prior to the massive hemorrhage, I had a transfusion in the same hospital where I would be admitted. I had a blood transfusion in an observation area. For those who don't know about observation areas in hospitals, where you're not really admitted. You're not an ER patient anymore. You're in observation status, and there are some problems with some of that in the system too. So here I was in there getting 2 units of blood 3 days before I would have this man. Thank God I got those 2 units of blood, because the hemorrhage might have killed me otherwise. But I think it's a frustration many people have in our system, is the docs are so overloaded. Now, I'm not excusing. I do believe that probably there needed to be a more intense look at what's going on with this woman. But the reality is that doctors don't have time to spend the time to listen to patients the way they used to. They're so driven by, I've got X amount of minutes to see this patient. And perhaps in situations like mine is, oh my God, here's this woman again. She's anemic. She's postmenopausal, so that's not happening from anything that's happening to her in terms of her OBGYN issues. None of that. There just wasn't anything that helped me at that point where I could really, and because I was a patient in a very limited network, I couldn't really escalate myself out to another referral or to another doctor without permission of my primary care provider, unless I wanted to pay for it out of pocket. So again, that whole money situation enters in, even when you know something more is wrong with me and I need better care, I need more care. Oftentimes you don't have who's got the money to go pay a specialist to say, where am I bleeding? Where am I losing blood? So it was a very difficult situation, very tough.
And running in parallel to your own health care situation, the state there in Colorado had just gone through a transition on the way it opted for healthcare support for its people. Can you talk about that?
Absolutely. Colorado had done a cooperative had been set up under the Affordable Care Act. They allowed some states to set up cooperatives. And on the Affordable Care, on our exchange, our state exchange for people buying insurance benefits, that cooperative that was set up was one of the most affordable options for people to get relatively decent, with somewhat limited network of providers, but not too bad, and people could get coverage, and it was more affordable. Well, over time, a lot of people signed up for the plan. The State Insurance Commission started to look at whether or not it was viable financially if claims came in at a certain rate, and they decided to decertify that cooperative. The State Insurance Commission decertified it. So 83,000 Coloradans who were signed up for that plan were told with it that 6 weeks later they were not going to have that plan. It was going to go away. The other problem with that cooperative plan is because it qualified as the silver plan upon which subsidies to every other plan, federal subsidies, would be offered, because their rate was so low for premiums, it lowered all the subsidies down. So for instance, my subsidy was $12.50 a month. So I was going to pay this massive amount in insurance premium because age rating is still allowed under the Affordable Care Act. Heaven forbid, if you're over 55 years old, you're going to pay, they're allowed to charge up to 3 times as much. Now, Kaiser was very kind and only did 2.8% as much. They wanted to show us all that they were giving us some slack there. But $12.50 was my subsidy on my care. And all of us screamed about that because there were a number of families, especially service-related personnel up in the resort towns in Colorado, up in the mountains where Aspen and Vail and all those beautiful places where the beautiful people with a lot of money hang out. And they're served by a lot of people who make not even a living wage, who make a very low amount of wages. And those people were having to pay hundreds more for coverage for themselves than they might have to in Denver, because again, the rating was allowed to be different based on the cost of care in those areas. And in the resort towns, there may be only one small hospital that serves people. So the cooperative that was there was one of the only ways that these people could get affordable coverage of any kind. And when that went away, it left a real hole in how people started doing calculations. Can I afford coverage, or do I just pay the penalty and take my chances? Do I just pay the penalty for having no coverage and just pray that I don't get sick somewhere along the way? I felt that way. And I'm fortunate. Again, I'm so blessed to have such wonderful friends in my network of people that Wendell Potter put out a call for, contributions to help pay my insurance, which, that was wonderful. But it also, in some real ways feels terrible when your friends have to raise money for you to pay your insurance benefits. It's like, oh my God, it flies against everything that we all think for ourselves, that if I work hard, if I do my part and I pay my bills, everything's going to be okay. Well, our healthcare system has swallowed that kind of notion. There's no more assurance that if you work hard, you're going to be safe and well cared for. And certainly in Colorado, a lot of families are hurting. And that was kind of the impetus behind saying we've got to push for this amendment on the ballot. We've got to go for something better in this state. People deserve better, and we want to see if we can provide it.
So just about 4 minutes left. So the single payer system, is that something that we really can afford?
Oh, of course it's something we can afford. We can't afford to keep going the way we're going. I mean, I've seen PNHP, the Physicians for a National Health Program, does wonderful research on so many of these issues. And I've seen calculations that have shown that if we continue on the trajectory that we're on right now in terms of healthcare costs, by the year 2025, people will be paying more for their healthcare than they do for housing, than they do for any other thing in their family budgets. Now, how is that supposed to work for people? It's really a terrible situation. And, the other hat that I wear in my life as the executive director of Progressive Democrats of America, is super important to me in that we identify those progressive candidates around the country who deserve support for the work that they're doing to advance not only single-payer health care as the appropriate, sound economic system we need to have in our healthcare system, not to mention being more humane than what we're doing right now, but also living wages that I know you in Seattle know a lot about and have been leading on that for a long time, and climate change issues, and getting money out of campaign finance. So we're working hard on a lot of different levels, but absolutely single payers got to come to this country sooner rather than later.
And you actually believe it'll happen in your lifetime?
I do. Of course. I wouldn't be working like this if I didn't. Of course, I believe it will. And if we can elect Bernie Sanders, which I also believe we can do, and he has made very clear statements that he believes in Medicare for all single payer and he will fight for it. That is a different kind of statement coming from a presidential candidate than we've had in the past. I love it. It gives me a lot of courage to go forward, and I think it should for a lot of people in my generation who thought, oh my God, we're just going to have to pass the torch to the next generation to fight the good fight going forward. Well, for a change, now we can say, oh my gosh, maybe our generation's actually going to launch something that can make a positive change.
We're speaking with Donna Smith. She is Executive Director of Healthcare for All Colorado and Executive Director of Progressive Democrats of America. And you are one of the featured speakers at tonight's Physicians for National Health Plan Western Washington Chapter's annual meeting, which is happening starts at 7 o'clock.
It does.
Kane Hall, University of Washington.
Absolutely. That's very exciting. I'm so excited about that. John Nichols is going to be there from The Nation. John is a fabulous speaker. If you haven't had the chance to hear him speak, it's just wonderful, especially during election season. Oh my gosh. John is in his element during the election season, so it's just fabulous. So if you have a chance, you should come out and hear it.
Yeah, he's good. Good luck keeping him to the allotted time slot.
Yeah.
So with that, is there a website that, in addition to your organization, that people can turn to?
Absolutely. You can go to pdamerica.org if you'd like to go to Progressive Democrats and see what we're up to. If you'd like to see Healthcare for All Colorado, just go to hcacfoundation.org. And you can find us there and you can support our work. Later on this summer, we're going to put out a call for people to come to Colorado and help canvass and work. So be watching for those. We'll want you, Mike, to help us get that word out.
I will do my best.
All right.
Well, with that, we are unfortunately out of time. I want to thank you very much for coming and spending time with us this morning.
Thank you so much for having me on.